The key at the moment is it's all about the workforce stupid, because delivering healthcare change means remotivating a workforce, be they in healthcare or social care. And if you take that to devolution, I think it's a very exciting proposition, because you can play to people's value set around, we want to see change that's local and meaningful. And you often live in a world where structures come down from the top and there are a lot of processes. And most people want to know what's happening on the street next to me.
What you'll see from the political structures which sit across our devolution partners is that we'll be having active conversations with government about some of the things that will help us accelerate the pace of change within health and care across the city.
The national bodies are endeavouring to put the national central diktat aside and work with local people and local partners to deliver the new care models. Putting aside those organisational constructs and those structures and focusing on what ultimately we're all here for. And importantly, and should have started with this, it's about the individual. So the self-care and the prevention and working with the population themselves, they're designing it.
More and more we see the NHS working with colleagues in local government, in the third sector, to think about the populations they all serve. The exam question is, how do we make the best of what we've got, the hand we've been dealt? We think the answer is in place-based systems of care, a concept very familiar to colleagues in local government, increasingly so to colleagues in the NHS as well. Seeing population health systems as a really big prize here, going beyond simply the integration of care, and thinking about how place-based systems can help us make the most of what we've got, the complex and fragmented organisational arrangements and places involving local government, third sector and the NHS too.
And we as a group came away with 3 key takeaways. First, we think there's huge value in statewide investment in things like analytics, where it makes really good sense to do it once really well, built with local input, but then rolled out to local areas. Second, there is huge value in a multi-year, clear investment plan. And finally, New York recognizes that that transformation on this scale takes time. The state is absolutely pushing those provider networks to make change happen at pace. But they know this is a 5-year journey, not a 1-year journey, and they're not expecting miracles overnight.
There are some things that we're currently doing for which the evidence base is either very weak or doesn't exist at all. We should stop doing those things. There are other things that we do where there's a very good evidence base for effectiveness, but we're applying that intervention to the wrong population group or in the wrong context. The third group is perhaps the most challenging, where we have a range of interventions which are all evidence-based, but which have different levels of effectiveness and have different costs attached to them, and where we need to prioritize where we invest and where we disinvest. And we're not very good at doing that.
There is a lot of ambition for health in London now. We know the issues. We have begun to work together very well, and we have big ambition, and actually our public has big ambition as well. They're thinking along these lines, and they want us to be successful on this. Devolution is not going to give the magic answer here. You know, it's a process by which the people who are wise in the process use it to get the outcome, and they keep faith with that outcome.